Hello, everybody. My name is Dr. Zha. I am a physician at CBHA. I'm also the clinical lead liaison of the CBHA Task Force against COVID-19.
Hello, everybody. I'm Dr. Jude Alsarraj. I'm a clinical team member, and I'm working with Dr. Zha on the COVID-19 task force.
So we are back today to give you more updates and more information about COVID-19 in the country and in our community. So I'm going to start with the question. First of all, are we still doing social distancing?
Okay, let's make sure.
We are.
Yeah.
Yes.
Okay.
So my first question for you is that everybody is talking about flattening the curve. As a scientist, can you tell us what that means?
Yeah, so flattening the curve is extending the time of which people can get sick, which gives time for the healthcare to be able to accommodate everybody who's going to need help. So we really want to reduce the number of people who get sick. This is for sure. But what we also want to do is to extend the sickness over time. So for example, if we have 100 people, we'd rather have them get sick over 5 weeks instead of having them get sick over 1 week. Mm-hmm. And then, that will overwhelm the healthcare system. We won't be able to accommodate everybody. So we really have to flatten the curve. We must flatten the curve. And that will really save thousands of lives here in the United States and really everywhere else. To flatten the curve, so as we talked last time, wash hands. So if you go outside and come back, make sure that you wash your hands. Before eating, wash your hands. If you touch any surfaces that may be dirty, make sure that you wash your hands. Social distancing too, make sure that there's no close contact to people, and stay home, as much as you can. Also, don't go to the gym so you can work out at home. Little things here, help the vulnerable people. Go get their groceries, deliver it to them, because this will actually help the healthcare in general, not only the transmission of this disease. And since we're talking about this, I wanted to ask Dr. Zha about nursing homes. Mm-hmm. So we, they're vulnerable people who are really sick. A lot of our family members may be at a nursing home. Mm-hmm. So yes. What can we do to get them prepared and be ready for this pandemic?
Yes. So we have to pay attention to nursing home patients and nursing home residents and even visitations to the nursing home, because we know as a fact that nursing homes can become hotspots for outbreak. In fact, the first ever outbreak in the United States is at a nursing home in our Washington state. So there are a few reasons why nursing home residents are so vulnerable. First of all, they're medically vulnerable, meaning that they're older, they have comorbidities. Many of them are bedridden, they have issues that they cannot take care of by themselves. And the other thing is there are a lot of group activities in the nursing homes that require close contact. At the same time, there are a lot of visitations that people going in and out. We want to make nursing home a home environment, which means that we have to invite people in and out from the family. So that's another reason. So every nursing home should really have a infection control nurse or a plan in place, even just at a time when there is no pandemics. So this plan usually involves getting everybody vaccinated, including the staff as well as the residents, getting access to personal protective wear and having enough supplies in terms of masks and goggles and things like that. This also includes, at times of this, limiting visitations and trying to distance residents inside of the nursing home, maybe canceling some of the group activities. So if you're a nursing home or if you're a visitor to the nursing home and they are asking you to not come or they're asking you to come sparingly, please follow that direction, because that's one of the things that they are doing to try to limit exposure to the medically vulnerable. The other thing that we are trying to work with the local nursing home is to offer telehealth visits, which means that instead of bringing these medically vulnerable patients to a clinic where they can potentially be exposed to infections, we offer them to talk to them on the phone and diagnose on the phone instead.
So can you give us a little bit of information about telehealth? Can you prescribe medications? Are the patients talking to a provider? How is that working?
Yes,
here at CBHA?
so at CBHA, we have started a robust program for telehealth, telephone medicine. This means that instead of coming in, we're asking you to call us. And yes, when you talk to us on the phone, you will talk to a provider. This might not be your personal provider or the provider that you usually go to, but this will be a provider. We'll try to accommodate for you to talk to your own provider, but this will be certified and trained provider who is doing telehealth every day. Okay, so yes, we can prescribe medications over the phone if that seems necessary. Like we said, we've trained almost all of our physicians and providers here at CBHA to be able to do this.
That's great.
Yeah.
So for telehealth visits, you said that you won't necessarily see your primary care physician and provider. So if you have to see somebody else, would your primary care provider have access to everything and all the records? And that provider too, who's seeing me, does he have access to everything else in the clinic, all my charts, all my medications?
Yes. Yeah, the answer is yes. So if you're talking to somebody who is not your regular provider, it still means that everybody has access to the health record of you. And if there's a reason to consult your own provider, it's easy for us to do it here as well. I also want to mention that if we determine on the phone that you sound like you should be somebody who should come into clinic to be seen, so in addition to the telehealth visit, you would have a clinic visit. The telehealth visit charge will be waived.
Right.
Okay, so Dr. Alsarraj, my question next for you is that is it true that pregnant patients are at high risk for this infection, and what happens if they get sick?
So there's really no evidence that pregnant women do have higher risk of getting COVID-19 disease caused by the coronavirus. However, we know that their bodies go through a lot of changes when they are pregnant, so they could be higher risk of getting sick. So for example, for influenza, we know that pregnant women tend to get a little bit more severe of a disease for influenza when they get infected. But however, there's really no evidence for anything yet. We're just waiting for more publications and stuff like that. Now, what we know is they have to be careful. Every pregnant woman has to be careful the same way as the general public, washing hands, staying away from sick people, staying home as much as possible. So basically just do the same personal measures that anybody else will do, and that should be good. Now, a recent study came where the 38 pregnant women were studied, and what they found that there was no maternal death, there was no transmission from the mom to the fetus of the coronavirus. So these 38 pregnant ladies, they were diagnosed with coronavirus, but there was no transmission from them to the babies. And when they took samples from the babies, there was no they were all negative, so there was no positive case for coronavirus. So this is a little bit, reassuring. We probably need bigger numbers,
yes.
But for now, that's what we know. So it's a little bit reassuring.
What about kids?
Yeah, so we saw that recent study. We were talking about it, Dr. Zha and I, this morning. So the recent study actually tell us that kids do get sick. I mean, we have this thought that kids are carriers only. They're all asymptomatic and they do not get sick. This does not seem to be true. So the kids get sick, and we do have numbers here that from this recent publications that for kids age less than 1, 17.7% got sick. And for
out of the 2,000 kids they studied.
Exactly, and this study was from China. So they studied 2,000 kids. 17% of these kids got sick. Were under 1. And that ones under 10 were 65%. So kids between newborn until 10, they do get sick. So we just want to emphasize that. Now, it depends on the severity of the disease. So not everybody had a severe disease. However, there was only 4.4% of these kids were asymptomatic, where they did not have any symptoms. And 50% of the kids had mild disease. And there was, some of them was critical disease, but 50%.
About 13% were critical.
Right. And about 50% were mild. So we do expect kids to get sick as well. So just keep that in mind, that if they get sick, it could be coronavirus.
So this leads to my next question. So since OB patients are a at-risk group, what are we doing here at CBHA to protect them?
Yeah, so here at CBHA, this is a great question because we're really trying our best to keep everybody safe, clinics safe, our patients safe, our providers, all the clinical staff, everybody here, we're trying to keep them safe. So one of the things that we're doing is air filtration. So what we're doing is creating additional negative pressure areas to extract the air from the high-risk locations. So what we're doing is, and we're actually purging fresh air there. So every exam room, every area that is, patient care, what we're doing is we are, it's getting total air volume filtered 10 times every hour, which is about every 6 minutes. We're filtrating that air. So just to keep it, as safe as possible, that's happening here in Othello. So for OB patients, we're trying our best to keep everything, as clean as possible and as safe as possible for them to come and do their routine visits.
Yes. And we talk about negative pressure room a lot. That means that if we have a high-risk patient or a patient that we are thinking probably have COVID-19, they go to these negative pressure rooms. These rooms are 100% not leaking air into the other area, which is why they're called negative pressure.
Right.
So a lot of people are asking us, what are we doing to protect our staff and provider?
Yeah. Do you have any, we got a lot of questions.
Yes.
And, everybody's asking that, providers, staff.
Yeah.
So
there are a few things. There are actually quite a few things that we're doing to make sure that our providers and staff are safe. I'd like to just mention a few of them. Number one, the most important thing that you have also mentioned a little bit is called geographic cohorting. This is something that the entire nation and internationally, we as a medical community are doing. We're trying to separate people who are sick and possibly have COVID-19 from the rest of the visitors to our clinic. And this means that our OB patients who are otherwise healthy goes to a totally separate area than other patients who potentially have the disease, even with using a separate entrance from the rest of them. We have strict protocol in terms of screening patients, not only on the phone when they make an appointment, but also at the door to cohort people into different categories so that we can separate them geographically. We also have started a robust telehealth visit protocol, like we just mentioned. A lot of our visits are on the phone now, and this is not just CBHA, this is the entire nation, the entire world are doing that. We have good evidence to show that that works, and we're all trained to do that. This way we can protect our providers as well as the general public and create that safe environment to socially distant.
Right.
So I do want to mention at this point that people are worried about our providers and staff. We have protocols in terms of what happens if you are exposed. We have definitions in terms of what are close contact. We limit the possibility of getting into close contact with anybody. Of course, that cannot be totally avoided in healthcare. So if exposure does happen, we have strict protocol in terms of what to do after that as well. So there are also protocols that we follow strictly by the CDC's guideline in terms of disinfecting our rooms, especially those negative pressure rooms after a patient leaves. So providers and people who work in healthcare, including staff and our other staff members here at CBHA, are on the priority list to be tested if they were to develop symptoms.
Right. This is really reassuring because we do get this question
A lot, yes.
Okay. So that's it for today. So thank you for watching us, and we'll see you next time.
See you soon.